The herpes simplex virus, the virus that causes cold sores, is incredibly contagious. An infection with the virus is really common, says Dr. Donald Brown, a primary care practitioner at Houston Methodist. In fact, more than 50% of adults in the U.S. are infected with the type of herpes virus that commonly causes cold sores. Interestingly, however, most people who contract the virus never show symptoms. If the virus causes cold sores, it can spread from person to person through close contact, such as kissing. But, while you may not know it, viruses can also be spread by sharing cosmetics, food and drink, lip balm, razors, toothbrushes, towels, utensils and drinking glasses. The virus is most contagious when there's a cold sore, especially when it starts to blister, Dr. Brown adds. However, it's important to know that you can still spread the virus after a cold sore has healed, even when a blister isn't present. For those who are no strangers to those painful, fluid-filled blisters, when you get a cold, you probably want it to go away quickly. What are the best ways to get rid of cold sores? Unfortunately, there is no cure for cold sores, and cold sores can take 2 to 4 weeks to heal on their own. But, there are things you can do to make them go away faster. Here are 3 things that can help relieve or clear up a cold faster. 1. Try home remedies. When used early, there are several treatments that can help reduce pain and swelling, and even shorten the duration of a cold sore. Cold, damp washcloth, ice or cold compress, petroleum jelly, pain relievers, such as ibuprofen and acetaminophen. 2. Apply topical creams and ointments. There are some over-the-counter anesthetic ointments and creams that can help control pain, such as lidocaine or benzocaine. Some products, such as those containing docosahexaenol or benzyl alcohol, may promote faster healing when used early and in sufficient quantities. 3. Take prescription drugs. There are antiviral medications that can help cold sores heal faster, including acyclovir, valacyclovir, famciclovir and penciclovir. If you have frequent outbreaks or are experiencing some of the more serious side effects of the common cold, your doctor may consider prescribing antiviral medications. To get rid of a cold sore quickly, the best thing you can do is start treating it as soon as possible, says Dr. Brown. A burning or tingling sensation on your lips or face can be an early warning sign that a cold is coming on, and the sooner you start reducing the swelling and treating the cold sore, the better. The faster it heals. How can I prevent cold sores from forming? So you nipped your last cold sore in the bud like a champ, and it lasted less than a week. But here you are, just a few months later, and the cold sores are back. There's good news, and then there's bad news. Let's start with the bad news. Once a person is infected with the herpes simplex virus, they are infected for life, says Dr. Brown. After a cold sore heals, the virus isn't actually cleared from your body. Instead, the virus goes back into your nerves, where it can lie dormant for a long time. When the virus reproduces happens, so it usually does. Same place as before. So what causes the virus to reactivate and cause a flare-up? Dr. Brown says an outbreak of the common cold can be triggered by fever, illness, including a cold, menstruation, stress, sunlight, weakened immune system. But, here's the good news. While you can't do much about some of these triggers, others can be avoided. Stress can weaken your immune system, which can be a trigger for cold sores to reoccur. If you suffer from cold sores and think they may be due to stress, it's a good idea to manage your stress through meditation or other relaxation techniques, suggests Dr. Brown. If you've noticed that your flare-ups are related to sunlight, be sure to apply sunscreen or a sun protective lip balm before going out in the sun.